Hi, good morning. It's Crystal with Catching Up with Crystal coming to you today with a little bit of information on how to check our blood sugars. Now, I have to check my blood sugar because I am on a medication called prednisone. Prednisone is a steroid, and one of the side effects of prednisone is it can increase your blood sugars. I'm on a long-term course of steroids. Now, if you're only on steroids for a little bit, it's not likely to affect your blood sugar, but long term it might. So I have a glucometer. This is called a glucometer. Now, they all look kind of similar, and they all kind of basically work the same, but there might be some variations to it. These are the test strips. Now, each glucometer, as you may notice, mine is called, this one came from Walgreens. It's called a True Metrics. So you want to make sure that your strips are compatible with the glucometer machine. So I have True Metrics strips and I have a True Metrics glucometer. However, some strips are interchangeable with other strips. This is called a lancet. This is what's going to end up pricking your finger. And inside the lancet is placed in here. I do have an alcohol swab, but you really don't need it. If you wash your hands, you should be good enough. One of the other things you want to do is you want to rotate your finger sites. If you use the same finger the same time all the time, it will you'll end up getting sore fingertips. So I am a fan of the thumb because my thumb has thicker skin. I'm a big baby. I'm a fan of that. You want to wash your hands well or use your alcohol. I prefer the side of the finger. Some people will tell you the fingertip. It's more painful. It has more nerve endings. I prefer the side of the finger. Okay. So I'm just going to show you my lancet. See how that just popped off? I already have a used one on here. I get rid of mine. Some people reuse them over and over. They get dull after a while, and they not only that, they prick you. You got blood on it, and you don't want bacteria growing on that. So what I do is I take a brand new lancet. The top just pops off. Now, all of them might not be identical, but you are going to end up with a lancet. For this True Metrics one, which I purchased at Walgreens, the lancet fits right inside of this little slot here, if you can see that. Then I put my top on, and it's screwed on. Do you see these numbers on the side? These numbers on the side are important because it lets you know how deep the needle will go into your finger. So you decide what's your comfort level. I always pick between a 2 or a 3 because it means it's not going to be as shallow. So what I do is I take my alcohol swab or wash my hands, and I I open it up. I pop open my glucometer strip. Now, glucometer strips do have an expiration date on the back. Mine expire February 2028. So there's a lot number and an expiration on the back. See this little coded section here? And then there's a spot here. The blood is going to go on the top. It's going to suck in like a straw. And see, you'll kind of just insert the coded part in there and it'll come on. And see, it's telling you to add a drop of blood here. Did you hear that beep? It's telling me to put my blood on the strip. So I wipe, like I said, I like my thumb. And I allow it to air dry. If you don't allow the alcohol to dry, it can give you a faulty reading. So we want this to be as accurate as possible. Okay. So I give it a little bit of time to dry. I don't do a lot of waving around or whatever. My alcohol swab was not overly saturated. So my thumb is dry already. What I do, I call it milking, where you can see the finger that you choose. If you milk it, if your hands are cold, it's going to be harder to get blood. Cold hands don't give a good blood. Warm hands do. So I milk it, and do you see that my thumb is red? I know I have a good blood supply. I take my lancet, I place it here, and I stick. See, I got my blood, and it's asking me, my glucometer is asking me, see it beeping, it's asking me to put blood. Now watch how it just sucks it up. Heard it beep? It sucked it up like a straw. Now it's processing it. And my blood sugar is 121. That is not great. Anything over 100 is considered diabetes. And like I said, I am on prednisone, and prednisone can raise your blood sugar. I just basically wipe my finger off with the same alcohol, or you can wash your hands, whatever. If you're on aspirin or a blood thinner, it might make you bleed a little longer. But anyway, I hope this has been helpful. I tried to keep this video short. Life is what you make it, so make the most out of life. Keep up with me, because you never know where I'm going to be. If you like more content like this, please let me know. This is Catching Up with Crystal. Hit that bell notification so you know when new content is posted. Like and subscribe. Talk to you later in the next video.